Good morning, everyone. I hope you're well. Short little video to talk about the critically important intersegmental stabilizer of the lumbar spine. And we use that description intersegmental to distinguish it from general stabilizers of the lumbar spine and mobilizers of the lumbar spine. And that's what core strengthening does. Core strengthening enhances the general stabilizers. It has very little ability to enhance the function of the intersegmental stabilizers or the multifidus muscle, especially once dysfunction has entrenched, and that is a consequence of a neuropathology, which we refer to as activation suppression. And the reason why the intersegmental stabilizers are so important is that those muscles behave as your cross bracing, like the cross bracing that you might see on a cantilever or a crane, those little crisscrossing beams that provide that intersegmental stability. So we have these muscles naturally in our body, and they effectively provide the same function as a titanium intersegmental stabilizer. So here you can see a lumbar fusion that's maintained or acquired artificially by the insertion of titanium intersegmental stability. And so those titanium rods are basically replacing the dysfunctional multifidus muscle, which is designed to do that work for you. Now, obviously, most people who suffer from back pain don't want to proceed down the line of a major lumbar fusion to regain stability. So if we can get patients participating in functional movement therapy at an early stage, we can naturally regain functional control of the multifidus muscle, and therefore we regain intersegmental stability. Now, if patients get sidetracked and they do massage therapy or deep tissue release or general exercise and core strengthening, which fail to restore the multifidus muscle function, and they present with severe multifidus muscle atrophy and dysfunction, then we do have the technology now to artificially, using the reactivate multifidus muscle functional neurostimulator, which you can see here. This device is like a pacemaker for the back muscle, for the multifidus muscle, and we can restore that electrophysiology and that communication between the brain and the multifidus muscle to optimize its functional proficiency. Now, of course, even the multifidus muscle functional neurostimulator, the reactivate device, if the multifidus muscle dysfunction is left to severe levels, even this device is going to have difficulty in restoring intersegmental stability, even when it's combined with functional movement therapy. So in those circumstances, those poor people really end up having no choice but to revert back to a major structural intervention. And of course, the two surgical options for regaining intersegmental stability are the fusion or artificial disc replacement. And of course, that can be achieved through numerous approaches. So the take-home message is maintain your intersegmental stability, primarily by maintaining functional movement proficiency lifelong. Thanks a lot. Talk to you next time.